Hello fellow classmates, my name is Diorella and I am here at our local urgent care facility. I chose this facility because I wanted to take a closer look as it could be my potential employer after graduation.
Multicare is a statewide healthcare organization that specializes in providing quality healthcare to all members of the community. Now, this is a brief overview of Multicare and what they provide to all communities across Washington state. They are founded in 1882. It was named Fannie C. Paddock. It's after the wife of Mr. Paddock. And now it is called Tacoma General. It is a nonprofit healthcare organization, and it currently has 8 hospitals and still growing. And it also has numerous clinics throughout the state of Washington. And their mission is partnering for healing and a healthy future, as well as it's the Pacific Northwest's highest value system of health. And also they developed a marketing strategy of sort, and they call it as First Touch. It's more like a first contact, building that first impression, and it's their goal to expand access to care and market presence. So they really do like a customer-centric environment. And their marketing objective, that is part of that as well. And of course, they use the real stories from those patients that had a very, very, very well rated and great experience, first impression, all of that. And this slide, we will be beginning to dive into Multicare and how they remain the leading healthcare provider to the private sector. So the first thing, we'll go through SWOT analysis: strength, weakness, opportunities, and threats. And the next one would be target market description and value proposition. So when I did the SWOT analysis for Multicare, the major strength that I found and also experienced, while we were here for 2 years, going on 3 now, the local industry is the leader around here in Puget Sound, and they are steadily growing up north and of course toward the east of Washington as well. And I'll talk more about that later on in the slide. Their major strength, they are the leader in the private healthcare in the Puget Sound, and the major weakness, it's more like their broad spectrum of approach to patient care. It leaves the organization lacking in specialization. So they do have the ready clinics. They do have urgent care clinics, readily accessible, and it's in multiple locations. But it seems because they do have this really well expanded access to care, I think they're just losing out on specializing one or a few things. The opportunity I found, the capturing patients under the U.S. Family Health Plan, that's actually under TRICARE. This area is full of retirees, armed forces, and as well as active duty, and along with their families. So there's a whole community that's transferring from TRICARE Prime to U.S. Family Health Plan, because what Multicare is offering, which is easy access to care, it's low cost, and the referrals is pretty efficient, and of course they're very proficient as well. Compared, as what the patient stated, they're more proficient in that, and it's less hassle, quote. So they're switching from TRICARE Prime to U.S. Family Health Plan, and Multicare is grabbing a huge lot of group of patients. And the major threats, competitors from opposing healthcare organizations, even though they don't have a huge expansion of access to care, like small clinics, like urgent care clinics, what Multicare has, or primary care clinics, annexes. Even though they don't have that huge expansion compared to Multicare, it's just they do their strength in that the comparative strength is the specialty, which Multicare's weakness. So that's what I find. I found that's the major threat is the comparator specialty, which a lot of the patients use. So the target market for Multicare, they focus on convenience, the cost-conscious patients, and of course, quality impact, the role that it plays in accepting multiple third-party payers and insurance companies. And the next slide is the target description. Around this place, it's focused on the Puget Sound, the Pierce County area. It's a lot of tech-savvy population, highly educated. It's usually with bachelor's and master's degree. This is due to the 3 big corporations that are located in Seattle, which is Boeing, Microsoft, and Amazon. And a lot of them do commute over there, but they do still, this is where they live, which is more affordable in the living. And of course, that is why Multicare is heavily expanded over here, and of course expanding as well up in King County just to serve those people as well. So the geographic, again, Pierce County, and they are slowly expanding to King County. And of course, we should not forget the active duty members and the retirees, along with the college students that's coming from abroad and of course throughout the United States. And the psychographics I've mentioned before in a couple of slides, they focus on the convenience, the speed, the time spent in the clinics, and of course cost conscious. The behavior, they are very health conscious population. They are willing to stay healthy and stay active, and they do follow up on their post-op care plan. And the next slide is the value proposition and their competitive positioning. I have included Madigan Army over here. This is because, yes, they are low cost, but they're also limited access. They're just the appointment time, and of course, there's just a lot of soldiers, and of course with their families, and even though it is a tertiary medical center, they are still overwhelmed, and that's from not one of the staff, but most of the staff when I do go over there for volunteer work. And I put Multicare up over here because of their easy access around here and their successful expansion. And of course, the competitors is the CHI Franciscan, along with St. Joseph, and of course the Seattle Children's Hospital. I put that there because we do have a good amount of community over here that uses this hospital for their children, for behavioral health, autism, and of course in the spectrum area, and of course surgery. The next slide is the marketing mix. We'll be talking about product, price, the distribution place, and of course the promotion, marketing communications. So according to Christy McCarran, the Senior Vice President of Retail Health and Community-Based Care, she stated, "You're most appealing if you have a larger geographic reach." So as we move into a higher deductible health plans, people do need to have access to services that are price sensitive. So it's important to have multiple channels for care that is affordable. That's well said. I can't say any better than that. So the next slide is the product strategies. As you can see, the urgent care clinics are available in multiple locations around here in Pierce County, and they are steadily expanding up in King County as well as in the east side of Washington State. And of course, their efficiency and proficient care. The competitors, they do lack the volume of available clinics, because they are more focused on specialties. But some of the patients do express that they are efficient and proficient in their specialty services. Consistently rated high quality on patient satisfaction surveys. It was noted in the my paper that I included as an exhibit that their rating of 4.9 out of 5. And of course, multi-care brands, their urgent care clinics, they currently name one of their urgent care clinics as Indigo Care, Urgent Care. And it's a more like a cafe style, as they said. So since this is the Starbucks headquarters, they pretty much I guess they probably corroborated with them, but I didn't get enough data on that. But it's just when I did experience, just to try it out, it felt you were in a cafe. It's just they have a concierge or like a barista that gives you a cappuccino or beverage. So it's a very, very customer centric environment. So at this time, there's really no recommendations for their current product, and of course this brand new branded urgent care. And so then we're going to move on to the next slide, is the price strategies. So the pricing breakdown is, of course, they're looking at the patient need, which is convenience, and of course the speed, the time spent in the clinic, and of course the insurance contracts, the coverage. Of course, if to some patients that does self-pay discounts, and we do have a lot of financial assistance programs available here in the state. And the next one is multiple pricing metrics. They do try to not try, but they do correlate it to socio-economical position of the patients that they have around in this community. And of course they do follow with the local reference-based pricing guidelines. They do have it, not all, but they do have it public accessible. But if you do want a further data, you do need to request that. They do have the form on their webpage, and you just fill out the form and just request your reasoning, and it just takes time. So I did fill it out, but so this is only how much I got from them. The next slide is the distribution strategies. So Indigo Urgent Care is the primary channel and the secondary channels are, the multi-care primary clinics. It is a value network because there are multiple interactions between the patient and the third-party payers, providers, even the state lawmakers and federal agencies. So this is to ensure the patient has input and fully understands what the total cost of health services rendered. So at this time, I don't have any recommendations to modify that. The next slide is promotion strategies. So the current market communication strategy is the region's identity, and of course the successful patient stories and inclusion of the community. Multicare's ability to tap into the local psychological makeup of the target audience, it does put them ahead of its competitors because they are very active and present, and they're just all over the place. They're pretty much like the Starbucks around this area. So their primary promotion tools that they use the media outlets really strongly, and of course the digital advertising and customer referrals. The multicare currently maintains outstanding patient relations. They do have a lot of foundations, programs, volunteer work. They pretty much have a grasp in every avenue that they could. So at this time, I don't have any recommendations to modify or add into it because I think they pretty much thought of, I wouldn't say they thought of everything, but I'm pretty sure they have a full grasp. The next slide is measurements. So the private market growth metrics, Multicare utilizes the patient satisfaction surveys. They generate an annual quality report card. It's also made available public on their website as well. And to measure, they do measure the total market share, the new patient enrollments, patient referrals, and patient retention. So they are very patient customer centric, as you could say. And the next slide, to conclude it, Multicare is the current leader in the Pacific Northwest, and they're slowly, steadily expanding up north, which is around King County, Seattle, and of course Bellingham, towards Canada. As part of an integrated healthcare network, they are integrated with Embright. They have Multicare also partnered with UW Medicine, and this is a benefit to enhance the access to care for patients and of course improve their quality care. And of course, last but not least, it does lower the overall healthcare cost. And of course, their smart marketing and reactivity to changes in patient needs ensures their position in the marketplace. That is very true. So I hope that I conveyed how Multicare does their marketing strategies, the impact, the role. I hope I successfully conveyed that. Thank you for taking the time to look at my PowerPoint show and my video. You have a good evening.